Unit 3 Mental Health and Mental Hygiene Part 2. First topic is defense mechanism and its implications. So, in simple words, what is defense mechanism means when a person faces a difficult or stressful situation, the mind may automatically use a defense mechanism to reduce the emotional discomfort. For example, a student fails an exam and says, "The exam was unfair, I would have passed otherwise." This can be a defense mechanism because the person is protecting themselves from the painful feeling of failure. We'll move to the implications of defense mechanism. So under that first one is assessment. So what is this assessment means? The nurse assesses the patient's thoughts, feelings, behavior and coping methods. So finding out how the patient is dealing with stress. Second one is understanding patient behavior. That means the nurse should understand why the patient is behaving in a particular way. For example, a patient who denies having an illness may be using denial to protect themselves from fear. Next one is therapeutic communication. That means the nurse uses calm, respectful and non-judgmental communication. For example, instead of saying you are wrong, just say, "Can you tell me more about how you are feeling?" Next one is maintain a therapeutic relationship. That means the nurse should develop a relationship based on trust, respect and acceptance. So make the patient feel safe enough to talk openly. Next one is promote healthy coping. That means the nurse helps the patient replace unhealthy defense mechanism with healthy ways of dealing with stress. For example, instead of avoiding a problem, teach the patient to identify the problem and discuss possible solution. Next one is patient education. That means teach the patient about what is defense mechanism, how stress affects thoughts and behavior. So, it helps the patient to understand their behavior and learn better ways to cope. Next one is documentation. That means the nurse should accurately record important observation and interventions. So, write clearly what you observed, what you did and how the patient is responded. Next, we will move to the frustration and conflict under the types of conflicts and measures to overcome it is there. So, first we will learn what is frustration and conflict. Frustration definition: it is an emotional feeling that happens when a person cannot achieve what they want or need because something is stopping them. So, frustration means I want something but I am unable to get it. For example, a student studies hard but fails an exam. That is also a frustration. Next one is conflict. That means conflict occurs when a person has two or more opposite choices, needs, thoughts or desires, making it difficult to decide what to do. In simple word, conflict means I want two different things but I cannot choose easily. For example, a student wants to study but also want to go out with friends. That is a conflict. Next we will move to the types of conflict. First one, approach conflict. That means choosing between two good things. The person wants both choices but can choose only one. For example, you get an offer for two good jobs at the same time. You want both but you must choose only one. Second one is avoidance conflict. That means choosing between two unpleasant things. That means the person does not want either choice but has to choose one. For example, you have to either take a painful injection or undergo an uncomfortable procedure. Third one, approach avoidance conflict. That means one choice has both good and bad sides. The person wants something but it also afraid or worried about it. For example, a patient wants to have surgery because it will improve their health but it is afraid of the pain and risk. Next one, double approach avoidance conflict. That means two choices are available and both have good and bad side. The person has difficulty choosing because each option has advantage also and also disadvantage. For example, a person has two job offer. Job A, good salary but far from home. Job B, near home but lower salary. Both choices have positive and negative points. So the person becomes confused. Next we will move to the measures to overcome frustration and conflict. First one, identify the problem. First, find out what is causing the frustration or conflict. Ask what is the actual problem. Understand the person needs, feelings and concerns. Find the root cause of the problem. Second one, encourage effective communication. That means Encourage the person to talk openly about their feelings and problems. Listen carefully, speak calmly, avoid blaming or criticizing. Allow the person to express their thoughts. Talk and listen to understand each other. Third one, set realistic goals. That means help the person to set goals that are possible to achieve. Break a big goal into small steps. Avoid expecting immediate result and appreciate small achievements also. So set goals that are practical and achievable. Next one, problem solving. That means help the person find different solution to the problem. Identify the problem, think of possible solution, choose the best solution, try it, check whether it is working or not. So find a solution instead of only worrying about the problem. Fifth one, develop healthy coping mechanism. That means teach the person healthy way to manage stress and frustration. For example, deep breathing and relaxation, exercises, talking to someone they trust, hobbies, advocate sleep. So use healthy methods to handle stress instead of anger, substance abuse, or avoid the problem. Next one is sixth one, improve decision making. That means help the person make decisions calmly and logically. Identify the available choices. Think about the advantages and disadvantages. So think before deciding. Next one is seventh one, provide emotional support. That means give the person understanding, encouragement, and reassurance. That listen without judging, show empathy, encourage the person, let them know they are not alone. So support the person emotionally and help them feel safe. Next, we will move to the role of nurse in reducing frustration and conflict and enhancing coping. Another first one is assessment. The nurses assess the patient's feelings, behavior, stress, and problem. So, find out what is troubling the patient and how they are dealing with. Second one, establish a therapeutic relationship. That means the nurses develops a relationship based on trust, respect, and understanding. So, build trust so that patient feels comfortable talking to you. Next one is encourage expression of feelings. That means encourage the patient to talk about their emotions and problems. So help the patient express anger, fear, sadness, or worry in a healthy way. Fourth one, help to identify the problem. That means help the patient to understand what is actually causing the frustration or conflict. So help the patient find the root cause. Fifth one, assist in problem solving. That means help the patient think of possible solution. So help the patient find practical solutions instead of feeling helpless. Next one, teach healthy coping strategies. That means teach the patient healthy ways to manage stress like exercises, advocate sleep, hobbies. So teach the patient better way to handle stress and problems. Seventh one, improve communication skills. That means teach the patient to communicate clearly and respectfully, and also good communication reduces misunderstanding and conflicts. Next, we will move to the dealing with ego. That means dealing with ego means helping the patient maintain a healthy and realistic view of themselves, manage stress and anxiety, and handle problems in a healthy way. So, maintaining a healthy sense of self means helping the patient to develop self confidence and self respect without feeling superior or inferior to others. So, if a patient fails an examination, instead of blaming everyone else, the nurse can help the patient accept the failure, understand the reason, learn from it, and plan how to improve. Next, we will move to the role of nurse in dealing with ego. Under that first one, accept the patient. That means accept the patient as they are without judging, criticizing, or blaming them. Show respect and understanding. Next one, establish a therapeutic relationship. That means build a trusting and supportive relationship with the patient. Make the patient feel safe and comfortable to share their thoughts and feelings. Next one, maintain a non-threatening environment. That means provide a calm, safe environment where the patient does not feel frightened, embarrassed, or threatened. Next one, encourage self-awareness. That means help the patient understand their own feelings, thoughts, behavior, strength, and weakness. This helps them to understand themselves better. Next one, use therapeutic communication. That means listen carefully and speak in a calm, respectful, and supportive way. Avoid arguing or criticizing the patient. Next one, encourage healthy coping mechanism. That means teach and encourage positive way of dealing with stress, anxiety, anger and conflicts. For example, relaxation, talking about feelings, problem solving exercises and seeking support.